Have you ever felt a strange cramp or heaviness in your legs while walking? Maybe you brushed it off as just getting older or being out of shape. But what if your body is actually trying to warn you about something much more serious, something that could lead to permanent damage or even life-threatening complications? Most people associate artery blockages with the heart, but did you know they can also restrict blood flow to your legs and feet? This condition is called peripheral artery disease, PAD, and it's far more common than you might think. It happens when plaque builds up in your arteries, narrowing the blood flow to your lower limbs. Left untreated, PAD can cause pain, slow healing wounds, infections, and even amputations. Even worse, it significantly raises your risk of a heart attack or stroke. The good news? If caught early, many of these complications can be prevented. That's why it's crucial to recognize the warning signs. In this video, we'll cover 7 critical symptoms of PAD that you should never ignore. Let's get started. Number 1, leg pain or cramping during activity. Have you ever started walking or climbing stairs only to feel an aching, cramping, or heaviness in your legs? Maybe it stops once you rest, so you don't think much of it. But then, the next time you start moving, it comes back. If this sounds familiar, it could be more than just fatigue. It could be a warning sign of peripheral artery disease. When your arteries are narrowed or blocked, they can't deliver enough oxygen-rich blood to your leg muscles when they need it most, during physical activity. As a result, your muscles struggle, leading to pain, cramping, or tightness in your legs. This condition, called intermittent claudication, follows a distinct pattern. Discomfort starts with movement and disappears with rest. However, as PAD worsens, the pain may occur even when you're sitting still. The location of your pain can also reveal where the blockage is. If you feel cramping in your calves, the blockage is likely lower in the leg. Pain in your thighs suggests a blockage higher up, while discomfort in your buttocks may indicate a more severe, widespread disease. Many people dismiss leg pain as a normal part of aging or a sign of being out of shape, but this is not normal. Ignoring it allows PAD to progress, potentially leading to serious complications, including wounds that don't heal, infections, or even amputation. If you notice this pattern of leg pain, don't brush it off, talk to your doctor. Number 2, weak or absent pulses in the legs or feet. One of the earliest and most important signs of peripheral artery disease is a weak or absent pulse in the legs or feet. When arteries become blocked, blood flow to the lower limbs is restricted, which can make it difficult for doctors, or even you, to feel a pulse in certain areas. During a physical exam, doctors check for pulses in 3 key locations: behind the knee, popliteal artery, on top of the foot, dorsalis pedis artery, and behind the ankle, posterior tibial artery. These areas are where the major arteries run, supplying blood to your legs and feet. If your doctor struggles to find a pulse or notices that it feels much weaker than normal, it's a strong indicator that your circulation is compromised. A weak pulse suggests that blood is struggling to flow past a blockage, while a completely absent pulse can signal a more severe arterial obstruction. This is particularly concerning because restricted blood flow increases the risk of pain, slow healing wounds, infections, and even tissue death, gangrene. To confirm PAD, doctors use 2 common tests. A Doppler ultrasound provides a detailed look at blood flow in the arteries, detecting any blockages or narrowing. Another test, the ankle brachial index, ABI, compares blood pressure in your legs and arms. A significant difference between the two suggests reduced circulation, a hallmark of PAD. If you or your doctor notice weak or absent pulses, don't ignore them. Early detection can prevent serious complications. Number 3, skin color or temperature changes in the legs and feet. Have you ever noticed that one of your legs looks paler than the other when you prop it up? Or maybe when you're sitting or standing, your foot takes on a bluish or purplish tint. These subtle changes might seem harmless, but they could be an early warning sign of poor circulation caused by peripheral artery disease. When blood flow is restricted, your leg may appear much paler when elevated because oxygen-rich blood isn't reaching the tissues effectively. Then, when you lower your leg or stand up, gravity causes blood to pool in the area, leading to a bluish or purplish discoloration. These color changes may start off as subtle but become more noticeable as PAD worsens. The reason this happens is that blocked arteries prevent enough oxygen and nutrients from being delivered to the lower limbs. This affects the health of your skin and the ability to regulate temperature, making the affected leg or foot appear discolored, dry, or thin. When tissues don't get enough blood flow, even small changes in skin color can indicate a much larger circulation problem. Another key symptom of PAD is a noticeable difference in temperature between your legs. If one foot or leg feels significantly colder than the other, it could mean that blood is not circulating properly to that limb. A severe blockage could be preventing adequate warmth and nutrients from reaching the tissues. If you notice persistent color or temperature changes in your legs or feet, it's important to take them seriously and consult a doctor. Early intervention can help prevent complications like ulcers, infections, or even the risk of limb amputation. Number 4. Slow healing sores or wounds. Have you ever had a small cut, blister, or scrape on your leg or foot that just wouldn't heal? Maybe it lingered for weeks, or instead of getting better, it became red, swollen, or even infected. While slow-healing wounds might not seem like a serious issue at first, they can actually be a major warning sign of poor circulation caused by peripheral artery disease, PAD. Your body relies on oxygen and nutrient-rich blood to heal wounds properly. But when arteries are blocked or narrowed, blood flow to the legs and feet is restricted, making it much harder for even minor injuries to heal. Without enough oxygen and nutrients, the healing process slows down, and the risk of infection, ulcers, and severe complications increases. One of the biggest red flags to watch for is cuts or scrapes that take weeks to heal or show no signs of improvement. Even small wounds can quickly become infected, leading to painful sores or ulcers, especially on the feet and toes. If left untreated, these wounds can become deep, difficult to manage, and may even lead to tissue death, gangrene. This is particularly dangerous for people with diabetes, who often experience nerve damage, neuropathy, in their feet, making them less likely to notice injuries until they become serious. If you have a wound on your leg or foot that isn't healing as expected, don't ignore it. It could be a critical sign of poor circulation, and early treatment is essential to prevent severe complications. Always check your legs and feet regularly, especially if you have risk factors like diabetes, high cholesterol, or high blood pressure. Number 5. Shiny, hairless skin on the legs. Have you noticed that the skin on your legs looks unusually smooth, almost shiny? Or maybe you've realized that hair that once grew on your lower legs has started thinning or disappearing entirely. These changes may not seem like a big deal at first, but they could be a key warning sign of peripheral artery disease, a condition that restricts blood flow to the legs and feet. Healthy circulation is essential for nourishing skin, hair follicles, and toenails. When arteries become blocked or narrowed, these areas no longer receive the oxygen and nutrients they need to grow and function properly. Over time, this poor circulation leads to hair loss, skin changes, and brittle nails. One of the clearest signs of reduced blood flow is shiny, tight-looking skin on the legs. The skin may appear stretched, thin, or almost polished in certain areas. Another major clue is the loss of hair on the legs, especially if you used to have hair that now seems to be disappearing in patches. Since hair follicles rely on a steady supply of nutrients, reduced circulation can cause them to stop producing hair altogether. In addition, thinning, slow growing, or brittle toenails can indicate that your feet aren't receiving enough blood supply to support healthy nail growth. While many people assume these changes are just part of aging, they're actually a sign of poor circulation. If you notice any of these symptoms, don't ignore them. Talk to your doctor, as catching PAD early can help prevent more serious complications like infections, ulcers, or even the risk of limb loss. Number 6. Erectile dysfunction. Circulation problems don't just affect the heart and legs, they can also impact other areas of the body in ways many people don't immediately connect to vascular health. One lesser-known but important sign of peripheral artery disease is poor circulation in the lower body, including the pelvic region. Just like the arteries in your legs, the arteries supplying blood to this area can become narrowed or blocked due to the buildup of plaque, restricting blood flow. This reduced circulation can lead to noticeable changes in function and is often one of the earliest signs of vascular disease. Why does this matter? Studies show that up to 70% of men with PAD experience circulation-related issues in this region, often before they even notice leg pain or other classic PAD symptoms. Because vascular health is closely linked to heart health, problems in this area could be an early warning sign of serious artery blockages elsewhere, including the heart. If you have noticed sudden or worsening issues, it's essential to discuss it with your doctor. Identifying and treating PAD early can help improve circulation, lower the risk of serious complications like heart attacks and strokes, and support overall vascular health. If you're experiencing any PAD symptoms, whether it's leg pain, cramping, skin changes, or poor circulation, seeking medical advice early can make all the difference in protecting your long-term health. Number 7. Numbness or weakness in the legs. Have you ever experienced a tingling, numbness, or weakness in your legs that doesn't seem to go away? Maybe your legs feel unusually heavy after sitting for a while, or you notice a strange pins and needles sensation in your feet. While occasional numbness might not seem alarming, if it happens frequently or is getting worse over time, it could be a serious warning sign of peripheral artery disease. When blood flow to the legs is restricted due to artery blockages, the muscles and nerves don't receive the oxygen and nutrients they need to function properly. This can lead to numbness, tingling, and weakness, making it harder to move around or even stand for long periods. Some people describe it as if their legs are constantly falling asleep, while others feel like their muscles have lost their strength. Over time, if PAD progresses, poor circulation can even cause muscle wasting, where the muscles shrink due to lack of use and nourishment. These symptoms should never be ignored, as they can signal severe arterial blockages that increase the risk of complications like non-healing wounds, infections, and mobility loss. If you frequently experience numbness, weakness, or heaviness in your legs, it's important to get checked by a doctor as soon as possible. Early detection and treatment of PAD can improve circulation, restore function, and help prevent more serious complications down the road. Prevention and next steps. Detecting peripheral artery disease early is crucial because it doesn't just affect your legs, it significantly increases the risk of heart attacks and strokes. Since PAD is caused by the same plaque buildup that leads to cardiovascular disease, ignoring the warning signs could have serious consequences. The good news is that lifestyle changes and medical treatments can improve circulation, reduce symptoms, and prevent complications. The earlier you take action, the better your chances of avoiding severe outcomes like infections, ulcers, or even limb loss. One of the most effective ways to lower your risk is to quit smoking, as it's the #1 cause of PAD. Smoking damages blood vessels and accelerates plaque buildup, making circulation problems worse. Eating a heart-healthy diet rich in whole foods while avoiding processed foods and high cholesterol meals can help keep arteries clear. Regular exercise, especially walking, is also key, as it encourages better blood flow and strengthens your cardiovascular system. If you have diabetes or high blood pressure, keeping them under control is essential, as both conditions contribute to arterial damage. Finally, make sure to see your doctor regularly. Early testing can detect PAD before symptoms become severe, allowing for timely treatment and a better quality of life. Peripheral artery disease is more than just discomfort in your legs. It's a serious circulatory issue that can lead to pain, infections, heart attacks, strokes, and even amputations if left untreated. The warning signs may start subtly, but they should never be ignored. If you've noticed leg pain, cramping, numbness, skin changes, or slow healing wounds, these could be early indicators of blocked arteries. The sooner you seek medical advice, the better your chances of preventing severe complications. Your legs carry you through life, and they deserve your attention and care. Take action today, quit smoking, eat a healthy diet, stay active, and monitor your vascular health. Don't wait until it's too late. Listen to your body, recognize the signs, and protect your health.